Did you know that persistent itching in certain parts of the body, especially in older adults, could be your body's subtle way of warning you about something serious, even cancer? Most people brush off a little itch here and there. Maybe it's dry skin, maybe a new soap, or just aging. But for those of us over 60, itching in specific areas can be much more than a minor irritation. In some cases, it could be your body's early distress signal, one that deserves attention. In this video, we're going to reveal 5 specific areas on the body where unexplained itching could signal cancer, sometimes months before any other symptoms appear. These aren't random itches. They're patterns doctors have seen again and again in people who were later diagnosed with serious conditions such as lymphoma, pancreatic cancer, breast cancer, and even skin cancer. So, stick with me through the end, because we won't just list body parts. We'll explore the deeper medical reasons behind each type of itch, what cancers they're associated with, and how to tell the difference between a harmless skin issue and a sign that something deeper might be going on. You'll walk away knowing what warning signs to watch for, what questions to ask your doctor, and what steps to take if one of these symptoms sounds familiar. Now, let's be clear. This video is not meant to cause fear. It's about awareness and early detection. Because when it comes to cancer, the earlier you spot the signs, the better your chances of successful treatment. Let's begin. Sign number 1. Persistent itching on the lower legs. If you're over 60 and you've noticed a persistent, unexplained itch on your lower legs, particularly the shins or calves, it's worth paying attention, especially if there's no visible rash, no new soap, and no lotion seems to help. This type of itch has shown up quietly and consistently in people who were later diagnosed with blood-related cancers, particularly Hodgkin's lymphoma. Here's why. Cancers like lymphoma start in the lymphatic system, which plays a major role in your immune defense and fluid drainage. As cancer cells multiply, they release inflammatory substances into the bloodstream. These substances can irritate nerve endings, especially in the lower limbs, and cause a deep, unrelenting itch, even though the skin appears completely normal on the surface. It's not like dry skin. It often gets worse at night, and lotions offer little to no relief. Let me tell you about a man named George, age 75. During a cancer awareness event, he shared that for 6 months, his only symptom was a nagging itch on the front of his legs. His doctor first suspected eczema or detergent irritation, but when routine blood work showed unusual white blood cell levels, scans later revealed swollen lymph nodes. The diagnosis? Lymphoma. And that itch? It was the very first sign his body gave him. George's story is not unique. The key is in the pattern. No visible rash or bug bites, no new products, and no relief from moisturizers or creams. If this sounds familiar, and especially if it's accompanied by other subtle symptoms, like night sweats, unexplained fatigue, or weight loss, it's time to take it seriously and get it checked. As we age, our bodies don't always shout when something is wrong. The warning signs become quieter, more subtle. Pain might not come right away. Lumps can be too deep to feel, but the nerves still react, and itching can be one of the first and only signs that something isn't right. If you or a loved one has been endlessly scratching their legs every night with no explanation and no relief, don't ignore it. Talk to your doctor. Ask for blood work. Share the pattern. Sometimes the body whispers long before it shouts, and listening could save your life. Sign number 2. Itching between the shoulder blades or upper back. Next, let's talk about a very specific type of itching that often goes unnoticed or dismissed. An itch deep in the upper back, right between the shoulder blades. Most of the time people think it's from dry air, old age, bad posture, or maybe an annoying shirt tag. But for some older adults, this localized itch, especially when it feels like it's coming from beneath the skin, has been linked to pancreatic cancer. Now, I know it might sound odd. How could an internal organ like the pancreas cause an itch in the back? The answer lies in the bile ducts. As tumors in the pancreas begin to grow, they can block the bile ducts, which normally drain bile from the liver into the intestines. When that flow is disrupted, bile salts start to accumulate in the bloodstream, and one of the early effects of that buildup is nerve irritation. This often shows up in areas where the body has a dense concentrations of sensory nerves, like the upper back. Take Linda, age 70. She had what she called a phantom itch on her upper back. It would wake her up at night, and nothing helped. Not lotions, not back scratchers, not even changing her mattress. She said it felt like it was coming from the inside. During a routine checkup for fatigue, her liver enzymes were found to be elevated. Further imaging led to the discovery of a small tumor pressing on her bile duct. That itch? It was her first and only symptom. So if you've noticed a deep, unrelenting itch just between the shoulder blades, no rash or skin changes, no relief from moisturizers or creams, and especially if you also notice fatigue, dark-colored urine, pale stools, or digestive discomfort, it's time to speak up. We understand. Most people over 60 don't want to be seen as complainers, but your body knows what it's doing. When it gives you the same signal over and over again, it's not being dramatic, it's being wise. If you've found these first two signs helpful so far, please comment the number 2 below to let me know you're still with me. And if you haven't already, take a second to subscribe and turn on the bell icon so you never miss a video that could make a real difference in your health and peace of mind. Sign 3. Persistent scalp itching. When it's more than just dry skin. Let's face it, scalp itch happens. For many older adults, it's not unusual to feel a little dryness or irritation on the scalp, especially during winter or after switching hair products. But here's the part most people miss. When an itch on your scalp becomes constant, stubborn, and refuses to go away, no matter how many shampoos, oils, or creams you try, it could be more than just a surface issue. In some cases, it could be a hidden warning sign of something far more serious happening inside the body. Doctors have seen cases where persistent scalp itching was one of the earliest clues to a blood-related cancer, like chronic lymphocytic leukemia. One patient, a 72-year-old man, shared that his scalp had been itching for weeks. There were no flakes, no redness, nothing unusual to see, just this nagging itch that returned every day, always in the same area. When blood tests were eventually done for unrelated fatigue, they found abnormally high white blood cell counts. A bone marrow biopsy confirmed it. Early-stage chronic lymphocytic leukemia. Incredibly, his scalp was the first and only part of his body sending a signal that something was wrong. What makes this so important is that many seniors already deal with some level of skin dryness or irritation. So when something like scalp itching starts to feel normal, it's easy to dismiss. But this kind of itch doesn't behave like normal dryness. It doesn't respond to moisturizers. It doesn't change with new shampoo. It lingers. It nags. And it often feels like it's coming from beneath the skin, not just the surface. It's not just leukemia we're talking about here. Skin cancers can also develop on the scalp. especially in spots where hair is thinning. And early signs are often subtle. A small patch of thickened skin, a spot that looks like a dry patch or tiny bump. But if it itches in the same location day after day and doesn't go away, it needs to be checked. The problem is, the scalp is one of the hardest places to examine on your own. That's why it's so helpful to ask someone you trust, a spouse, a caregiver, or even your hairdresser, to take a quick look, especially if you mention the itch and it hasn't gone away in a few weeks. If you notice a persistent itch on your scalp that doesn't budge, and especially if you've also been feeling more tired than usual, bruising easily, or just not feeling like yourself, don't ignore it. It might seem like a small issue, but as we've seen, sometimes it's the small things that tell the biggest stories. Sign 4. Itchy chest or breast area. A silent signal not to ignore. Now, let's move to an even more overlooked area, the chest and breast region. This is especially important for older women, but it can also apply to men. If you experience persistent itching in this area, particularly around the nipple or just beneath the breast, it's easy to chalk it up to tight clothing, sweat, or even aging skin. But in some cases, this type of itch could be an early red flag for a much more serious issue, such as inflammatory breast cancer or a tumor near the chest wall. Unlike typical breast cancer, inflammatory breast cancer doesn't always start with a lump. The first symptom might not be a pain or swelling. It might just be an itch, a deep, stubborn itch that doesn't move, doesn't fade, and doesn't respond to creams or lotions. Let me share the story of Ruth, age 69. She started noticing a strange itch on her right breast, just under the skin, near the outer edge. She switched bras, changed laundry detergents, even went braless for a while, thinking maybe it was pressure or friction. But the itching stayed. Same spot, same sensation, day after day. When she finally went in for a checkup, her doctor noticed some subtle dimpling on the skin and ordered additional tests. That's when they discovered a small but aggressive tumor, sitting close to the surface, growing silently, without the telltale lump most people expect. That's what makes inflammatory breast cancer so dangerous. It doesn't follow the usual rules. It may present like a rash or just a change in texture. Sometimes the skin feels warmer, thicker, or more irritated. Other times, there's no visual clue, just that unshakable feeling of itchiness. And this isn't just a women's issue. Men can develop breast cancer too. Though it's rare, it's often overlooked. A persistent itch near the nipple, a small patch of rough skin, or a nagging sensation under the chest muscle might not seem like a big deal. But in men over 60 or 70, it absolutely warrants a second look. Also worth noting, persistent itching in the chest or breast area can also be caused by swollen lymph nodes just under the arms or near the collarbone. That could be a sign of lymphoma or another nearby malignancy. So here's what to remember. If you've got an itch in this area that stays in one place, doesn't go away, and doesn't respond to moisturizers or other home remedies, don't write it off. Don't wait for a lump. Talk to your doctor. Let them examine it under proper light. It could be nothing, but if it's something, catching it early could make all the difference. And if this section has opened your eyes to something you've experienced or helped you think differently about a symptom, please type 4 in the comments below to let me know you're still with us. Also, if you haven't yet subscribed, now's the time. Hit that bell so you never miss a video designed to help you stay healthy, informed, and empowered as you age. We're not done yet. Let's keep going.